Hello, good morning everyone. First, I will wish everyone a very happy Independence Day, and I would like to thank Mrs. Preeti Shingare Madam, Director of Kindernook Preschool, for giving me this opportunity to share my experience. So today, I will discuss about the various types of diagnostic tests which are used for the diagnosis of corona infection. The first test, it is a RT-PCR. The full form for that test, it is a real-time polymerase chain reaction. This test is called as a gold standard test. Means this test is the best test available for the diagnosis of the corona infection. So when the test results come positive, it means that the patient is having corona infection. But the sensitivity of this test is 60 to 80%. Means when the test is positive, it indicates that the patient is having infection. But when the test results is negative, it does not completely exclude that the patient is not having the corona infections. In that case, we have to correlate it with the test results with the symptoms of the patient. So this is a RT-PCR test. The next test, it is a antigen detection test. The antigen detection test, they are also called as a point of care test or bedside test. They are the rapid test. We can get the results within the 30 minutes. So these are very rapid tests. But the drawback of this test is that the sensitivity of this test is only 30 to 40%. Means when the results for this antigen test is positive, it clearly or definitely indicates that the patient is having corona infection. But if the antigen test comes negative, it does not completely exclude that the patient is not having the corona infection. In that case, when the antigen test is negative, we have to go for the RT-PCR test for the confirmation of the diagnosis. So this is a antigen detection test, and this antigen detection test is usually used in the acute infectious case or before any surgeries. And the third type of test, they are called as the antibody test. Antibodies, these are the cells which are produced by our immunity to fight against the various infections. There are basically two types of antibodies, IgM antibodies and IgG antibodies. IgM antibodies, they are seen in the acute infections, and IgG antibodies, they are seen in the chronic infections. So when we do this antibody test, it indicates the prior infection with the corona infection. They do not indicate the acute infection, because 2 weeks are required to appear the antibody in the blood after the infection. So these tests, they are usually not used for the diagnosis of infection, but they are used to see the seroprevalence, means if the immunity is developed in the individual or not. So these are the antibody tests. So we have seen that the two tests, RT-PCR and antigen detection tests, they are the diagnostic tests, and antibody tests, these are used to see the seroprevalence or to see the immunity is developed or not. So this is all about the various tests which are available for the corona infections. Now I would like to say that we are fighting against the corona infections, and we will definitely come out of it. So have the patience, have good diet, take adequate sleep, and important one, follow the Trinity. Means sanitization, then disinfection, take the good diet, and appropriate sleep. So this is a Trinity we have to follow to fight against this corona infections. Thank you very much.